สวัสดีค่ะ Good morning. My name is อภิญญาสมพันธ์ I'm an instructor from JPN Intercare. For today, our first topic is about professional ethics or professional code of conduct. There are 6 subjects in this topic. I will clearly explain every subject of the topic to you. For the first one is to help a professional practice with consciousness and to be conscious in the values and dignities of human beings. To explain more about the first subject, I would like to say that every treatment or procedure you give to the patient, you should have full consciousness in giving all treatments. And please be aware of the values and dignities of human being. All people have the same values of life. Beware of it and don't take life for granted. For the second subject is to treat everyone equally without thinking about the differences of nationalities, religions, and division of a person. To explain more about this subject, I would say that you have no excuse to say no or to say not want or to say I don't want to treat others. This is the profession, the state that we state right here is the profession that we need to say yes to every division, nationalities, and religions. You cannot divide yourself with others if you are not the same religious with that patient. You should not say no in order to do any healthcare provider to them. For the third subject is do not treat others with pride and prejudice. Do not use your power for your own benefits. To explain more about the third subject, you should not see others with pride and you should not treat others with prejudice. For example, if you don't like that person, if they come and get the health care from your company or your area, you should not say no. For example, if that person you hate so much, you cannot say, I don't want to treat her or him. Fourth subject is keep the patient information as secret. Aside from the will of the patient with the approval consent form according to the law. To explain more about the fourth subject is for every caregiving from the profession, we have no right to tell anyone, even though they are your friends or your family. These caregiving procedures should be secret and kept for yourself and your patient. Unless if the patient wants to give this information to other healthcare provider, that will be need to sign the consent form from the patient. Fifth subject in this topic is performing your duty with all of your knowledge and skill in diagnosis and problem solving in health that is appropriate to person, family, and community. To explain more about the fifth subject is for everything you do, you need to put all your best efforts in every procedure and every health care you give to the patient. For the last subject in this topic is to conduct a prevention that might affects health of people, family, and communities. For example, to be aware of any danger that might happen to your patient or the people around you. After we all have learned about the profession ethics, the next topic that we need to understand is the patient's right. For the first subject of this topic is all patients has their rights to have a right treat and care from all health profession according to the law of Constitution. For the second subject of this topic is all patients has the right to know the truth about their health process and procedure, all side effects and the health care plan for the patient to be able to choose whatever they wanted or they don't want it to be treated, aside from the emergency cases. The third subject is in the emergency situation, patient will receive an emergency help from all health profession without waiting for the call out for help. The fourth one is all patients has their right to know all the name of their health care providers. The fifth one is the patient has all rights to ask for opinions from other healthcare provider aside from their present healthcare provider, and they has all right to change the healthcare provider according to their will. Next one is all patients has their right to keep their information a secret, aside from their willing or consent form signing to give the information for the benefits of healthcare profession field. The seventh subject is all patients has their right to know the information of all experiments they are involved in, and they have all rights to escape or be executed from the experiments they are holding. The eighth subject is all patients has their right to receive all of their health care plan information from the registration if that information doesn't affect any information of individual. And the last one is parents, mother or father of the patient has all rights to decide everything for the patient that is under age of 18 or physical and mental impairments which they are not able to decide on their own. For using the squeezing balls and the on and off pressure pipe, turn it to the right to close the pressure pipe so the mercury will be up. We should not do the mercury more than 200 in the normal blood pressure person, and after this we need to release the pressure down by turning the pipe left, and the mercury will go down. For the next procedure of vital sign measurement is temperature. The normal temperature is 37 plus and minus 0.5 Celsius. This temperature measurement is a thermometer. This thermometer consists of the scales and the mercuries. If it hits the high temperature, the mercury will run to the highest scale. If the temperature of a patient is more than 37.5 Celsius, it may be happen that the patient has fever. There are many kinds of thermometers nowadays. This one will be used to measure the infants. When the infant was born, put it on the ass in the hole, and this is the digital thermometer, which is more easily to use. The digital number will be up here about the Celsius that it happens to be the temperature of the person. Another one is to measure the temperature with a LED or a laser. You can point this to the forehead of the person and you will be able to know what is their temperature. Okay, for our next topic is the feeding through the NG tube or nasogastric tube. These are the indications for enteral feedings. The first one is the patient that cannot take in food by oral or malnutrition patients. The second one is unconscious patients. The third one is the swallowing disorder patient. The fourth one is partial intestinal failure. And the fifth one is anorexia nervosa. The last one is the patient that has an operation about the gastrointestinal tract. To feed through nasogastric tube is meant to give the blend diet through the nasogastric tube directly into the stomach of the patient with feeding food, water and medication through the NG tube so that the patient will be able to receive the food, water and medication that is sufficient for the body needed. And this is how we are going to prepare the blend diet food. The blended diet is separated to two kinds of diets. The first one is the instant BD or instant blend diet. That will come in the liquid form or maybe a powder form. A liquid form, we can give it to the patient directly according to the order of the doctor. And the powder form, you need to plus or add in the water to the powder and give the patient in the order according to the order of the doctor. And the second kind of the blended diet is homemade blended diet. That means you get the food or the powder, nutrition, protein, everything mixed together and blend it by your own self according to the order of the doctor. That is the homemade blended diet. There are two types of feeding the patient. The first type is intermittent enteral tube feeding, and the second type is continuous enteral tube feeding. For the intermittent internal tube feeding is separated into 4 to 5 times a day. Most of the time will be according to the meal time, like breakfast, lunch, dinner, or before bed. That might be 4 to 6 times according to the doctor's order. And the meal will contain the blended diet, water, and medication. And sometimes during the day or during the meal, we might give the patient the syrup or water in order for the patient to get enough food and nutrition. And the second type is continuous internal tube feeding. The continuous is the tube, the feeding will be feed throughout the day, like all the time, in order that the patient couldn't take in the food too much at one time, or the patient that has a problem in digesting, absorbing, or might adjust the amount by the medication that needs to give to the patient. So the continuous feeding is the feeding that you continuous all day long. Okay, and I will show you all the equipment and materials uses for the feeding through the NG tube or nasogastric tube. The first thing we needed is the liquid BD or blended diet, or the instant blended diet. It will be inside this kind of bags that has scales according to the doctor orders. You will see it sometimes in the medication center. The doctor will order it for you and the patient. Okay. It might come in the form of a can or a bag like this. This might be the continuous feeding because it can adjust how much food we give to the patient at one time. Okay. Okay. The next is the siign. Okay. It looks like this. Sometimes it comes in a glass type or maybe a plastic type. This possible use. Okay. A cotton ball that you pour the boiled water on it, or a sterile water for us to easily clean the tube, like cleaning the tube before put in the food. Alcohol hand rub and immersive basin. A glass to put in medication with scales, and a glass put in water. You can measure the water according to the doctor first. If the doctor wants you to get the nutrition or water according to his order, he will order us first, and we put it in the scale and pour it in the cup. And the most important thing is the glove. Okay. Steps of giving blended diet. First, we need to clean our hands, and second, prepare the blended diet according to the order of the doctor, and the third one is adjust the position of the patient. Make the patient sit upright or about 45 degrees upright to prevent the gag or the aspiration. Next, after adjusting the position of the patient and sucking out the secretion, open the opening joints and cramp Cramp the tube first. Open and take out the oxygen ออกมา ลืม โอเคค่ะ okay. Takes out the syringe to test whether the tube is inside the stomach. Okay. There are several ways to test whether the tube is inside the stomach or not. Okay, for the first way, we use the stethoscope. Okay. Open the tube. Okay. Clean the tube. Okay. The first way is we will push the air inside like this and listen to the air in the stomach of the patient. If you hear the air sound, it means the tube is inside the stomach of the patient. Okay. For the second way of testing whether the tube is inside the stomach or not, okay. Open the tube, clean it first, okay, with the boiled water or alcohol pad. Okay, put the syringe. Okay, and take out the secretion. If there are some substance coming up, it means the tube is inside the stomach of the patient. Okay. For the third way of testing is you pour the water inside the glass and open. Don't forget to clean before you do anything. Okay. Put the tips of the tube into the water and see if inside has a bubble or not. If it has a bubble, that means the patient might have the tube inside the lungs. You need to shake one more time. Okay, so after testing, we know already that the tube is inside the stomach. We are going to give the patient the blended diet or BD. Okay, cramp, open, clean, take the inner syringe out and put this here. Here. The order that we put like this is we can scale the amount of the blended diet according to the order of the doctor. Okay. For example, the blended diet is inside here. You pour it down until 50 milliliters. and you let go. You need to lift this higher than the patient, about 1 feet height, so the food will be able to go down to the intestine. If the food is coming to an end, don't let the food finish first. You need to pour directly more or cramp the tube first to prevent the air. You need to cramp it first and don't allow the air to go inside the stomach of the patient to prevent the patient from having the bloated stomach or to make the patient uncomfortable. If you see the food is finishing, put the water inside and together with the medication you prepare at the first time. The medication here, put inside and let the medication and water goes in. After that, you pour in water according to the doctor's order until you know that the tube is not stuck or blocked. Then you take the syringe out. Okay. Clean it again. And close it. Finish. And nowadays, when the blended diet comes as a type of a bag like this, it's easier. You should wash and put the blended diet inside. Open, clean, and put in. Okay. Wait for the food to be finished and you take the food out and put in medication. The same procedure as just now. Like this. Okay. Medication inside and water followed. Okay. Beware of the stacking of the medication. You should try to test if the tube is blocked or not. Okay. Before closing it, don't forget to clean the tube. And close it. Okay, finish. After feeding, you should keep the position of the patient upright or 45 degrees or more until him or her digests the food, or about 1 to 2 hours. For the next procedure is suction. Suction is the procedure that use the tube, a sterile tube, and put inside and suck up the secretion from the mouth, nose, or the tracheostomy tube. So how can we know if the patient needs suction? First of all, we need to look at the patient and see if the patient looks tired or have a hard time breathing, or when he breathes it makes a sound, or maybe you hear some sound inside the patient's lung. The next indication is when the patient has abnormal breathing sound or abnormal heart rate or pulse rate, and we need to observe the patient respiration rates and listen to the lungs of the patient if it has some abnormal sounds. The next indication for the patient that needs suction is you need to observe the patient's lips and hands or toe. If his or her lips has purple or bluish colors, or maybe the tips of the finger is changed the colors to purple or blue, that means the person has a cyanosis condition. So these are the equipment and materials used for suction. First, we need a suction machine which has a pressure and sucking pressure in this machine. And first of all, you need mask, face mask, clear water or clean water for you to clean the tube after using it. Glove, a sterile glove and a sterile tube. A suction tube might be like this. In order we use it in the hospital, or like this, which contains 3 ways of extension. So the process of the TG tube or tracheostomy tube suction at home is, first you need to clean your hand and wash your hand clean, and after that you tell the patient or the relatives what you are going to do to the patient to prevent them from being panic of what is happening next. The third one is you need to let the patient stop eating food or takes in food for about 4 hours before you do the procedure. Not taking in food might cause another thing is NPO or nothing per oral. That means the patient could not take anything in to prevent the aspirating. Okay, for the next step, lift up the patient position. Makes the patient sit up about 30 to 45 degrees, and before you do any procedure with the suction you need to wear mask. Now I couldn't wear it, so I could explain to you all clearly. So don't forget, every time you use or you do suction you need to wear mask. Okay, and every time you use the suction and the equipment you need to use the disposable equipment, because the glove and the tube should be only one time use. Wear the glove sterile. And hold the sterile thing with this sterile hand. Connect the tube. Be careful. Turn on. Okay. Use another hand to hold Okay. First of all, be careful, this is a sterile tube. Put it in the mouth first. Put it here first. Put it here and clean the secretion. Okay, and up. Clean the tube with the clean water. Okay, and after that, clean the secretion inside the mouth. Then clean and put it in the nose. Okay. All of this should be thrown in contaminated bin. Okay, so that's how you clean the secretion, and you need to understand and be aware that each time you clean or suction, it needs to be not more than 10 to 15 seconds to prevent the patient from having a sore or a wound or the blood that comes out. Okay. After you do the suction, you need to come and see over here to the container the amount of the secretion, the colors, the smell, and how does it look like. If it's abnormal, if it's have lots of blood or brown, or the color is not normal, you need to notify the doctor immediately. Okay, so the next procedure is how to take care of the patient with a Foley Cath. There are two important things to reconsider in taking care of the patient with Foley Cath. The first thing is the Foley Cath allows the urine to flow normally, and the second thing is to prevent the urinary tract infection. In allowing the urine to flow normally, you need to beware of the pipe. The urine pipe should not be twisted or cramped. If the urine pipe is twisted or cramped, the urine can't flow normally. And during the patient is sleeping, the pipe needs to be still, the bag needs to be still, and still under the bed of the patient like this, and the urine bags need to be lower than the bladder of the patient. While sleeping, the urine bag need to be lower than the bladder of the patient like this, and need to be still. The urine bag is used to observe the color of the urine and how the urine look like. If you found out that the urine has a sediment, things you should do is to use something to resist like this and try to make the urine pipe clear, and see the next time if the urine has a sediment. The patient from having urinary tract infection, first you need to give the patient enough water, 2.5 to 3 liters per day, and to wash over the pipe and make it in closed system always, and clean up the pipe or clean up the Foley Cath with the normal water 2 times a day, and you should release the water from the urine bag about every 6 to 8 hours, and after you release, you use the alcohol pad to clean up the tip of this, clean it up so that you could prevent the bacteria from going inside. Okay, and you need to clean the genital of the patient 2 times a day, morning and evening, to prevent the bacteria. After that, you need to change the bag after you notice that the bag is torn or the bag is leak out. Every month you need to change the bag, like once a month in the hospital. And the food that you need to give the patient has to be the food that is an acid, like fruits or maybe eggs or beans. That would help a lot in preventing the urinary tract infection. And one more thing that you need to be aware of when you take care of the patient is the sign of urinary tract infection. You could see if the patient has a beginning sign of urinary tract infection. The patient will have fever, shivering, and the pee or the water inside the bag is cloudy, like have some white substance inside, or maybe it has urine turbidity. So if this happens to the patient, you need to meet the doctor immediately to see and check if the patient has the urinary tract infection.